After kicking people out of it, he's going to stay over here. I will say I was not laughing at my child's suffering, and any kind of meanness in my body now is a result of having worked with Deitram for a number of years. So please don't judge all Canadians based on anything I might have done.
Just pointed at Deitram.
So yeah, I'm really happy to be back here. This room itself has fond memories. I was probably one of the first people to actually teach in this class. I did a Monday, Wednesday, Friday LSC 100 class, and when we renovated this building. And so it kind of brings me back to my first shaky day in class, thinking about what I was going to say to a group of people, most of which were taller than me and more athletic than me and more intimidating as I stood up here. But as much as I'd like to reminisce, I'm going to jump into some of the research that I've been doing while at the University of Georgia. Specifically around the issue of vaccines, which is not an issue that I was studying while at Wisconsin, but we're applying a lot of the same principles for issues that I was using here. Looking at things like nanotechnology while I was here, synthetic biology, and coming at vaccines from a similar lens, or at least a fairly similar lens. Kind of broke today's talk up into 3 different areas. Number 1, I just want to talk a little bit about the kind of scope of the problem when it comes to vaccines. I'm not fully familiar with what your background is and how aware you might be of these issues. My guess is that most of you don't regularly hear about vaccines or talk about it quite often, but when you do hear about it, it's when there's kind of an outbreak of measles, right? How many people remember the 2014-15 measles outbreak linked to Disney? Okay, a fair number of you not aware, which actually matches quite well with some of the data that we have here that I'll talk about in a little bit. So let's get a sense of what the problem is. From there, we'll kind of further dive into the problem. A data collection we did with myself and Dr. Glenn Nowak, who's a former CDC guy, who was an academic who kind of took a 10-year sabbatical and went to the CDC and was involved in their communications. He's someone that worked pretty extensively around vaccines, and when he came back into academia and him and I started working together, he wanted to really dive into this issue. What I'll be talking about in terms of this set of findings is contextualizing vaccines. Look at how parental opinion towards vaccines compares to some related issues, things like antibiotics, over-the-counter medicines, children's vitamins. How do they view these different things, and how do they view vaccines? And then last but not least, and probably where I'll spend the bulk of my talk, is looking at that Disneyland measles outbreak. So we happened to be in the field in November of 2014, and if you recall, news about the Disneyland measles outbreak really took off in mid to late December. I think around the 27th or 28th is when we found out that there were cases and it started being widely reported. So what we ended up doing was going back into the field a few months later, so we had kind of this nice pre-post data collection. And so we could look at how public opinion shifted from before the outbreak to after the outbreak. So that's where I'm hoping to concentrate the bulk of my talking points today. But first, let's look at the scope of this problem. So the main question is really one of, are people vaccinating? And the best evidence we have is actually quite positive. It's initially this idea that vaccination rates are either at or very close to their historical highs in this country. That goes for MMR, the measles, mumps, and rubella vaccine, which has coverage about 92% across the country. And right now that achieves what the CDC is looking for and what various organizations that work in this space. They're looking for about 90+% coverage rates with a goal of achieving 95% by 2020. So we're in a good spot, at least relative to kind of the broad spectrum or towards the population as a whole. But of course, other data suggests that there might be a problem. Probably the most noticeable one is the number of measles cases that we've seen over the years. So if you look back, all the way back to the year 2000, measles was determined to be eradicated in the United States. Now that obviously doesn't mean that there will never be measles cases, and this graph suggests that that obviously hasn't been the case, but it was deemed to be like no longer a domestic illness and no longer a domestic disease. And so the way in which it's coming into the country is because people from countries where coverage rates are lower, who might have the disease, can bring it in and then it can spread amongst certain populations. What we've seen since 2000 is some flatlining here all the way up to about 2007, relatively few measles cases, and then we start to get these little bumps, right? And so we kind of moved up here where we're approaching 100 seemed to be the new normal, and then another bump. And then obviously 2014 we had our biggest bump yet, up to about 650 cases. In the grand scheme of things, 650 cases in a country with, what are we looking at, 350 million? 330 million, that was No one knows.
You're going to be right.
Some north of 300 million people, not a huge issue necessarily, but one worth keeping an eye on. And certainly public health people are concerned about this, and the physicians that we've presented our data to are concerned about this. And they have anecdotal information about conversations they're having with patients that suggest they're very worried about what might happen if coverage rates start to drop. So if we have overall achieved kind of the 90+% that we're looking for in terms of coverage rates, why are we seeing these spikes? Why are we seeing these more cases about measles? And it really has to do with an issue of whether or not vaccinations are equally distributed in the population. And the answer is they're not. Right? You can look at it from a state level. Connecticut, very high MMR compliance, about 98% of people, of kindergarten children are fully up to date with their vaccines in that area. Whereas in Virginia, 83-ish%. And these fluctuate from year to year. I'm pretty confident no one in the back of the room can see this, but at least you can see the colors here. Map of the United States, where orange represents states that have had a drop in vaccines between the years 29-10, so that school year, all the way up through 2013-2014. So the orange ones are states where we're seeing declines in the rate of kindergarten children vaccinated, and this is probably even more difficult to see unless you're near the front. Some of these states are trimmed in red. Those are states that in 2015 had a measles case. So if you just glance at this data, what you see is, A, there's a fair amount of orange, and a lot of those orange states are outlined in red, meaning that rates are going down, and these states are experiencing measles outbreaks. And it's obviously not just states, right? These types of behaviors are clustered at a smaller level as well. Kind of in the same way that I'm sure students in this class are clustered together, or students in Madison, right? Do undergrads still live kind of in the Mountain Street area? That's where I lived initially. That's how I know undergrads live there, because it was out of place there. Graduate students more in the Jennifer Street, Willie area. Is that still true, basically? But we see this with vaccines as well. And so, how many people have heard of Vaccination Island? Anyone in here? Okay. You've heard of that one? So this is a place... Vaccination Island? My bad, sorry. I had a feeling I would pronounce it wrong and had someone call me out on that. Vaccination Island? Out in Washington State, off the coast, kind of close to Seattle, a few hours away, I think, by ferry or car. That's a place where we've seen kind of a clustering of anti-vaxxers, people that do not want to vaccinate their children or are choosing to not vaccinate their children. I think it's about 1 out of every 4 kids is not vaccinated in that community. So what we're seeing is, again, even at that community level, like-minded people kind of swarming together, people that are against the idea of vaccines and vaccinating their children. They're choosing not to do so. The problem with this, there's a reason I'm talking about these clusters, the problem with this is that when you have unequal distribution of vaccination coverage, herd immunity breaks down. And Teacher actually sent me a nice video, but I didn't throw it into the presentation just yet. But I have it mapped on the next slide here. So here's what happens when you have kind of a equally distributed group of vaccinated people. Yes, someone who's infected can come into a community, but because there's all these people that are vaccinated, it prevents major linkages from happening, and it kind of slows down or stops the spread of an outbreak. Whereas if you have clusters of people that are unvaccinated, the moment the virus gets in, the moment the disease gets in, it triggers this quick reaction. It can spread very quickly through the community. So this is why this idea of unequal distribution matters, right? It's not just we need to achieve 90+% coverage. What we need to do is make sure that it's equally distributed across the population. So, despite the overall high coverage rates, there's concern on several fronts. And this is from talking to physicians, this is looking at the social science data. Confidence is really starting to decay. It's still overall really high. People are generally pretty confident in the idea of vaccines. They generally believe they work. They generally believe they're a good thing for children to have. But we're slowly seeing these numbers creep down. So if you do comparisons across different studies, concerns are starting to grow. People are starting to question the efficacy of vaccines a little bit more. They're a little bit worried about what it does to a child, what the side effects might be. So concerns growing, confidence decaying, and the result seems to be that many parents are at least questioning the idea of whether they should stick to the schedule, right? They're saying, no, I'm not sure that I want my child to be part of this. I'm not sure I want my child to receive that many injections in a single visit. And so they're deviating from what would be the recommended schedule for vaccines. So there's the problem. Now I want to jump into some data here. We'll contextualize the problem a little bit more. So like I said, we happened to go into the field in November 2014. We obviously did not anticipate an outbreak taking place. We just went into the field to do a study on vaccines. And we were looking to compare it to other issues: over-the-counter medicines for children, vitamins for children, and antibiotics for children. So how do parents view all these 4 issues? Do they view it in a similar lens as they do vaccines? Are people fearful or starting to be more distrustful of these other things? Or is it a departure from that? We ended up doing a YouGov online survey. It's not a probability sample, but it is designed to be nationally representative. And the response rate was about 36%, which is actually pretty decent when it comes to online research. Ended up talking to 1,000 parents, and these parents had at least one child age 5 or younger. So we decided against doing a true kind of national study where we're looking at all Americans. We wanted to concentrate on one specific population: parents, people that had children, people that are wrestling with these types of decisions at this time. So we're not extrapolating to the larger population with any of these findings. We're talking about parents specifically. We kept the analysis here pretty basic. We're looking at simple crosstabs and ANOVAs. That's all I'll be showing you here today. We'll get into some more sophisticated stuff when I do the pre-post study. But we're looking at crosstabs and ANOVAs of parental confidence and concern, looking at their intention to vaccinate, their intention to give their child other health interventions, like I said, antibiotics, over-the-counter, things like that, and linking it to things like demographics. So just a quick overview of kind of who's vaccinating, who's not vaccinating, and how does it compare to other issues. Quick table here that just gives you a sense of how many parents are sticking to the schedule when it comes to having their child vaccinated. So has your youngest child received all, some, or none of the recommended vaccines to date? So there's a schedule that's put out there. Physicians are well aware of it. If you're a parent, you're probably pretty well aware of it. You know when you're supposed to do these things. You're told when you're supposed to do these things. And who's sticking to it? 3 in 4 parents, about 75%, say we're fully up to date. My child has received all the vaccines up to date. My child is fully compliant with the schedule. Look, 20% of people say that they're hit or miss. They have some of them, but not necessarily all of them. And there's a number of reasons why these people might not be vaccinating, right? Sometimes it's a health issue. If your child is sick at the time, they're not supposed to get a vaccine. Some of it could be religious or moral exemptions to it, where they're saying, look, I don't want to do this. I want to deviate from the schedule. I want to spread them out. I don't want these injections all happening at the same time. And then about 5% of people saying, no, my child has received none. So again, these are people, these are parents with children aged 5 and younger, meaning some are already in kindergarten, some might not be at that age yet. These numbers map out pretty well with other social science work in this area. Yes?
What's your overall end?
We're talking to 1,000 parents here.
1,000, sorry, thanks.
What I briefly want to talk, and I'm not going to show tables to show this, but I just decided to give a sense of who was compliant and who wasn't. And generally what we're finding is when it comes to people on schedule, they're more likely to be white as opposed to black or Hispanic, college educated, and have higher income. It's not incredibly high, but higher, north of $30,000 a year. Whereas those that departed from the schedule tend to be more likely to be black or Hispanic, have some college or less education, and have lower household incomes. And the reason I bring this up is because I think it's somewhat in contrast to at least one of the popular narratives that you might have encountered. Which isn't to say that narrative is wrong, but it's the idea that there are coastal, liberal, elites, high-income, high SES groups that are opting out of the idea of vaccinating their children. And these groups do exist. I'm not fighting against that. But at some level, I worry that it overshadows maybe a bigger problem. That for many people, it's not an issue of choosing not to vaccinate their children, departing from the schedule because they have adverse ideas about what it might do, but it's an issue of access. It's an issue of being aware of the schedule. It's an issue of having the proper coverage that they can have their vaccines paid for. It's an issue of having the time to take your child in to visit a doctor. And that's an issue that we're finding in kind of these lower SES groups in society. So I do think that there are different pockets of people that are off the schedule for very, very different reasons. And from a PR or marketing standpoint, you certainly need different messages to hit these people, right? For some, it's not even a messaging issue. It's an access issue. Can we provide coverage? And the degree to which that will happen moving forward is very much an open question, I think. Okay, so now we're doing some comparisons, looking at parents and their decision whether or not they want their child to receive a vaccine or if they're going to decline that. Comparing it to issues like antibiotics, over-the-counters, and children's vitamins. So we asked everybody the exact same question. Have you ever decided not to have your child or children get a recommended, and then you insert the topic here, vaccines, antibiotic, over-the-counter, children's vitamin, for reasons other than illness or allergy? And really, I just want to draw your attention to the percentage of people that are saying, yes, I've decided to opt out of something, to not have my child get it. It's about 20% for vaccines. So choosing to decline a vaccine for a reason other than illness or allergy. That doesn't mean they never come back and do it later on, but they're declining it at some level. It's larger than these other issues, and significantly so when you compare it to antibiotics, but generally on par with these other issues, right? There's a sizable percentage of people that are saying, if my physician told me to get an antibiotic, I've said no. I've said I don't need to do that. They told me to have an over-the-counter, children's vitamin, they've gone in a different direction. They've gone against the wishes of their physician. So I'm trying to paint this in terms of potentially, vaccines are potentially a major issue here, but we might have something bigger creeping in. This might be kind of the idea that people aren't trusting physicians in general when it comes to recommended treatments. And we're certainly seeing at least some of that, these other issues. I don't show it here, but kind of for the record, if you map these out and you look at who's declined vaccines, a sizable percentage of them are also declining these other behaviors. So it is, at some level, kind of a narrow problem where a small group of people are saying no to everything, but it's not exclusively the case that. There's a number of people that are being very selective, saying, over-the-counter is not for me, but if it was an antibiotic, I would do it. They're selective at some level. And then just showing you really how nicely they map up over-the-counters and vaccines, very similar in terms of the percentage breakdown across all of them. Next, do you plan or intend to have your child get all the remaining recommended vaccines? There's no equivalent for the other issues. There's no schedule to receive antibiotics, so we had to come up with a slightly different question wording. And we asked, if your child was ill and your physician recommended it, would you have your child take it? Again, what I'm trying to show you here are very similar percentages across these issues. About 75% of people saying, yes, I would do that. About 75% of people saying, yes, I would do that, which leaves a sizable percentage of people, about 25%, saying either, I'm not sure, I'm undecided on the issue, or flat out, no. They tell me to do something, I go the opposite direction. Which again, painting this as maybe a broader problem than we've been led on to believe. And one last set of findings when it comes to this initial data set, and then I'll jump into the pre-post stuff here. Consistently, as I've been working through this data, and my colleagues have been working through this data, adverse events have popped up as being a really important driver of attitudes. When parents see their child receive a stomach ache, a flu, anything after receiving a vaccine, they get very worried. When they hear about it from other people as well, when they hear a story from a friend or a neighbor that says, yeah, we gave little Billy his MMR, and all of a sudden he had vomiting, diarrhea, he wasn't feeling well. That impacts parents quite a bit. It impacts them across issues. So people that have not had any adverse event experience, they report not hearing about these type of things, no friend or close loved one or their own child hasn't received one. Their confidence levels across these issues, confidence that their child won't have a serious adverse reaction, confidence that vaccines are effective, confidence that their child's health will benefit, are pretty high on these 1 to 10 scales. They're scoring north of 7, so pretty confident group. They believe in vaccines, they trust vaccines. Same thing with antibiotics. We're north of 7 on all these ones. When you find groups and you ask groups who have had these adverse experiences, when they've seen their child have a bad reaction, when they've heard about a neighbor or colleague who had a bad reaction, their child having a bad reaction, we see across both issues that these numbers obviously go down. That's not particularly surprising. But it's a much more dramatic drop for the issue of vaccines. It ends up mattering a little bit more for this issue. And then the next slide, I'm going to show you why this really matters. Because it also maps out in terms of intent to follow schedules later on, or intent to adhere to recommendations later on. You see about a 17 or so percent drop, 16, 17% drop in terms of compliance among people who have had no adverse events versus people that have had one. Whereas for antibiotics, it's pretty stable. It actually goes up slightly, which is not a significant increase or anything like that, but it's pretty consistent. So what you see is, yes, their confidence erodes for antibiotics, but it's not quite the same scenario as vaccines. It doesn't necessarily translate into this shift in actual intentions moving forward. So I think adverse events is kind of the next area that we're diving into with this data set. I don't have much in terms of sharing it today, but I'm starting to take a look at that as a key driver when it comes to anti-vaccine attitudes. summary slide here. Confidence overall quite high and comparable to other children's health interventions, but still a sizable percentage of the population who are willing to go against the advice of a physician. And that adverse events really matter, and they really seem to matter for vaccines. They matter for all issues, but they really matter for vaccines. Okay, so study 3, where we had this really unique data collection, pre-post data, something that I'm really happy to have and I've really kind of jumped into in the last little while. If you have not heard, how many people again have heard about the Disneyland outbreak? A few of you, not as many, not quite half the class even. It's a couple years old, so it's not particularly surprising. It originated in California, so we had infected people arriving at Disneyland and then spreading it to other infected people that happened to be there. And then you could see the cases kind of moving across the country. Somehow the data was skipped as part of this. I'm light on theory with this. Most of this is very practical research, looking at different types of behaviors among parents. But the two theories that we've kind of had in mind when looking at this pre-post data collection have been fear appeals, the idea that we use messages to arouse some level of fear in people, and then we give them a strategy. So our belief, and I'll talk about this in a second. Health belief model, similar idea, right? Behaviors are determined by threat perceptions along with strategies to mitigate these. So the way we've looked at these pre-post data is we have baseline, then we had an event that should instill some level of at least salience to the issue, if not fear. It presents this idea that if my child is not vaccinated, this is possible, right? My child could be part of an outbreak. My child could go to a theme park, my child could go to a mall, could go to a restaurant, catch the virus, and then all of a sudden that they would be infected and this would be problematic. So that's a scary proposition for parents, especially when you're dealing with young children. It's particularly scary when you have a 4, 5, 6-year-old or an infant child. Our belief with this was that an event like the outbreak, which was receiving pretty extensive media coverage, and which we were following pretty extensively in terms of its coverage, yes, it's fearful, but at the same time, a lot of those newscasts, a lot of the conversations that were resulting were saying, but there is a solution, right? The solution is vaccinate your children. There are opportunities to do this. They were telling you how to do it, whether or not you were covered, how to find out if you were covered. So we envisioned kind of the outbreak as this fear appeal message, this frightening message, but also a lot of the coverage that surrounds it as driving people towards a way they could solve this problem, a way they could alleviate this fear. So we ended up, like I said, going back into the field with a second YouGov survey. We ended up doing it in, I believe, April of 2015, so a few months after the issue had kind of run its course. The cases had pretty much stopped by that point. Media coverage had died down. Ended up getting a response rate that was a little bit lower, but similar to our first survey. Again, we talked to parents, so we kept the exact same sampling procedure through the same company. We're grabbing from the same pool of people, but they're not the exact same people. It's not panel data where I'm saying Brian at time 1 and Brian at time 2. So keep that in mind as we work through it. Of course, we couldn't have predicted an outbreak, and so we didn't seek permission to have these people do a follow-up study. What I'll be showing you now are a series of regressions that predict vaccine confidence, concerns, and then future intentions. And then I'll be showing you a series of interactions about how different subgroups in the population responded. Did they change in their attitudes from time 1 to time 2? Did they change in their behaviors from time 1 to time 2? First, just by way of some context here, even in April of that year, in the months following pretty intense coverage of this event, and again, we're talking to parents, people that should be really motivated to pay attention to something like this. About half of people were even aware of the outbreak. So looking at about 48% of people that report being fully unaware, they had no idea this was taking place, or were unsure. They possibly heard something, but they couldn't report with any sort of authenticity or accuracy that they'd actually heard about this, which is somewhat surprising to us, but not particularly surprising when you think of how some people's media diets are, how all of our media diets are, and how we consume information. What we ended up finding, I won't go too deep into this, but those from an infected state tended to report higher levels of awareness, tended to think they knew more about the outbreak and the issue of measles. But when you look at their factual knowledge items that we had, they were basically no more likely than people from non-infected states to actually have an understanding of the issue. We had some admittedly tough knowledge questions, but they were no different than the other people. Okay, show you a regression analysis, and I'll just kind of map the information up here, so hopefully this will help it go down a little bit smoother. We're predicting confidence in vaccines and the belief that vaccines are good, they do good things for children. First is this data collection variable. What this shows you is that from time 1 to time 2, there was a significant increase in vaccine confidence. People were more confident in the idea, the good that vaccines do after the outbreak as opposed to earlier. Age, there was no impact. Gender, there was no impact. Race, we had no impact. Education, we have a positive impact here, positive relationship. More educated people tended to be a little bit more confident in the idea of vaccines. Interest in the issue, also significant. If you paid a lot of attention to the issue of vaccines, you tended to report higher levels of confidence in the good that they do. And then this last variable is vaccine status of one's child. So we asked these parents, is your child fully up to date? The parents that reported, yes, my child is fully up to date, were more likely to say, yes, vaccines are doing good things. They have more confidence in the idea of vaccines, which I think makes sense. All right, I'm going to show you another regression, and then I'm going to break down some different subgroup analyses that we had here. Once again, so we have this data variable here. So this time we're not predicting confidence in vaccines, we're kind of doing the flip side of it. We're predicting concern that a vaccine might not actually prevent the illness it's designed to prevent. We have a data effect, right? Again, so people were simultaneously more confident, yay, vaccines do good, they're good for society, and more concerned that maybe they don't prevent the disease. And I think you'll see some of this in these subgroup analyses I show you, why this might be the case. Age, no effect. Gender, we had an effect where females were a little bit more likely to report this concern. Certainly the case in my household. My wife's always a little bit more concerned than I am about these things. We have a race effect here where white respondents were less likely to report that a vaccine might not prevent the disease relative to Black and Hispanic audiences. Education effect, more educated people, less likely to have this concern. No effective interest here. And we have that vaccine status effect. People that are fully vaccinated were less likely to report a concern that a vaccine might not actually prevent the disease it's designed to prevent. So like I said, these look at the population as a whole. We ran a series of interactions as well, which I don't show here, but I'm going to map out on this slide. We're looking at 4 different groups that we broke down, and we're looking at their attitudes pre-outbreak versus post-outbreak. So right here, we're looking at that variable I just showed you, concerned that a vaccine might not actually prevent the disease it was designed to prevent. And I'm going to bring up these lines one at a time. So the first line, these are people who had a child that was fully vaccinated, but they reported that, generally speaking, across both data collections, these are people that don't pay a lot of attention to the issue. They're not that interested in vaccines, they don't follow the issue closely. What you saw here is from time 1 to time 2, this group became a little bit more concerned. Again, not panel data, but we're breaking down groups based on these variables. Next, we've got a fully vaccinated child, and we pay a little bit more attention to the issue. Essentially the same pattern here, the same effect, slightly more pronounced. They became a little bit more concerned at time 2, right? These are parents who are following this issue a little bit more. They became a little bit more concerned that maybe vaccines aren't doing what we want them to do necessarily. Next up, and we're following kind of the same general pattern here. These are parents who have a child that's not fully up to date in terms of their vaccines for whatever reason. Whether it's religious reasons, health reasons, they're not fully up to date, they're under vaccinated. And they don't report paying a lot of attention to the issue. They also have a slight increase. They're starting off higher in their level of concern, which is one of the reasons maybe that they're not fully up to date in terms of their vaccines. And it becomes a little bit more pronounced at time 2. So far, nothing too exciting. All these lines are going in the same direction. Drum roll for the 4th line, which will be a departure from this. This is the group that, again, their child's not fully vaccinated, but they report that they're really following the issue. So they may be agonizing over their decision and really paying attention to news in this area. This is the one group that actually shows a decline. Now this graph, I don't think visually shows it as nice as it actually is, and that's because these variables are really simplified. I mean, we dichotomize interest into low versus high. I think if we mapped it out in a different way, it'd be much more pronounced. But this is the one group where we're actually seeing, at least from from communicators that want to push the idea of vaccines, that want to communicate the benefits of vaccines, this is the one group that seemed to have that. This is the one group that reacted in the way we would want them to react after an outbreak, right? They became less concerned that a vaccine might not actually be working. They're less likely to feel that. Now they're starting off high again. And again, these are people with under-vaccinated children, so maybe that's not that surprising, but they're the lone group that kind of cuts in an opposite direction. So keep that in mind, and we'll work through another regression, and I'll show you this group again. They keep popping up as kind of the common group. This is a little bit different, but kind of in the same vein. Concerned that were my child not vaccinated, they would be at risk. So you want to be higher on this. right? Communicators in this space, physicians would want children to believe that, look, if they don't get vaccinated, there could potentially be problems. You want people to safeguard against that. Again, positive impact of data. So all these things are improving from time 1 to time 2. So we have parents that are simultaneously saying, I'm worried that these don't work, I'm confident that they work. There's a lot of conflicted feelings, it seems here. So we have a positive impact here. No impact of age. We have a kind of a small effect of gender. Again, females are a little bit more likely to report that if my child's not vaccinated, they would be at risk. No race effect. Education, one of the more consistent predictors that we have here. More educated people are more likely to believe if I don't vaccinate my child, they're going to be at risk. Interest, same pattern. The more interested you are, the more you feel that way. And once again, vaccine status. If your child's fully up to date, you're more likely to have this concern that they might be infected if they weren't up to date, which fits with how you want to think about that issue, I think. Okay, again, it's kind of these subgroups. We look at the same groups, again, looking at this dependent variable. So again, this is concern that if my child was not vaccinated, they would be at risk for the disease. We bring up the first fully vaccinated parents with a fully vaccinated child who weren't paying a lot of attention. Get a moderate increase in this concern from time 1 to time 2. Child's fully vaccinated, but they pay a lot more attention to this issue. They follow vaccines a little bit more closely. A slight increase from time 1 to time 2, essentially a flat line. Again, child not fully vaccinated, low vaccine interest. They're a little bit more concerned, but they're starting off in terms of their concern way down here. And then once again, we have our fourth group, that's the lone group that has a departure from this. They don't actually cut in an opposite direction, it's just a much more pronounced effect here. So they start off pretty low, very comparable to this group down here. These are parents with a child that's not fully vaccinated, but they're paying great levels of attention to the issue. By time 2, they're on par with some of these fully vaccinated groups. So again, if you're a communicator, and this is a group you want to reach, this is a group that has a child that's not fully up to date in terms of their vaccines, it seems interest can really drive in the direction you want. So you might be able to actually convince these people who are at least wrestling with this idea a little bit more that vaccines are a good thing and they should probably catch up in terms of their child's vaccination status. But does that actually happen? Does it actually translate into intentions moving forward? I had to do a logistic regression for that. I didn't want to map it out. I'll just give you some of the key findings here. This is the first regression that I ran where we didn't have a data impact, where it didn't shift from time 1 to time 2. Intentions did not move from time 1 to time 2. They're similar across both data sets. White respondents were more likely to report that they had a positive future intention to vaccinate. Vaccination status, once again, and interest were both positive predictors. That's kind of a pattern that we've seen the whole way through. If you're interested, if you're up to date, you're more likely to say, yes, I intend on following the schedule, I intend on having my child receive the rest of those vaccines. I felt that the best way to communicate what we're seeing here is a table, actually. And so I'll bring up a bunch of different groups. Again, these same 4 groups, one at a time. So these are people that were asked the question, has your child received all the vaccines today? So they said, none or some. No, my child is not fully vaccinated. Their level of interest is low. Here's their percentages from time 1 to time 2. 35% said, no, I don't plan on having my child receive all the recommended vaccines. That's pretty consistent at time 2. They're pretty consistent in terms of their beliefs. Percentage of unsure, essentially the same from time 1 to time 2. And the percentage of people saying, yes, I plan on having my child receive the recommended vaccines, the same. And it's really kind of a frighteningly low percentage of people that plan on doing this, less than 40% across both data sets. Nothing significant here. These people are very stable in their beliefs from time 1 to time 2. This is the group that, again, are reporting that they're not fully up to date with their child's vaccines, but they pay a lot of attention to this issue. This is that group that was showing a departure from all the other ones. This is the group that we're a little bit more optimistic about, right? They're a little bit more confident at time 2. Does that translate into intentions? The depressing answer is no, not at all. So I've bolded the different responses here. From time 1 to time 2, the percentage of people reporting, no, I don't plan on doing that, actually increased. It went from 20% to 37%. The percentage of people that were unsure went down, and the percentage of people that said yes increased, but not significantly so. So the optimism that we had when we were looking at those early things, we were seeing confidence move, we were seeing concerns go down, we thought that this group might be the one that kind of would report different vaccination intentions at time 2. Well, yeah, they did, but not necessarily in the direction we wanted. They became more certain, there was fewer uncertain people, but they kind of went in 2 different camps, and most of them went towards the no camp. which is a frightening idea here, and one we can come back to, I think, during the discussion. So that's what we're looking there. And then here's the group that is fully up to date with the vaccines, not paying a lot of attention. We see shifts here. Some of this might be kind of like a ceiling effect, where there was already very few people saying no, and that moved up to about 10%. And they had a decline in the yes. Significantly so, not what we're looking for, but a group that didn't really show any promise in terms of their attitudes moving much in the earlier progressions. And then this last group, fully up to date with their vaccines, paying a high degree of attention, pretty consistent across all these things. So the key group is really this one that just kept popping up when it came to attitudes, and we were hoping to see, yes, they're more confident, they're less concerned, they're probably going to be more likely to say, yes, I'm going to vaccinate my child moving forward. And depressingly, that wasn't the case. They didn't migrate in that direction. So kind of take-home messages here. Certainly some clear patterns across all these things. What we're seeing is education is a key driver. More educated people tend to be more confident and to be more have a greater intention to vaccinate. Current vaccination status, the idea that if you kind of get your children into the system, the parents are much more likely to say yes, that seems like a good idea, and kind of adhere to it. Those are the kind of the strongest and most stable predictors of this. The outbreak itself is really complicated, and we're still wrestling with this. I wouldn't say we have this nut cracked yet, right? We're still trying to understand exactly what's going on here. Confidence increased from time 1 to time 2, mostly among people that were really interested. We saw it kind of more pronounced among those groups. However, concerns increased as well, and so we have kind of this attitudes are moving, but they're moving in a variety of different directions. The outbreak, as I showed you with those different figures, had differential impacts on different respondents based on things like their current vaccination behaviors and the interest in the topic. So we kept seeing these things moving in different directions. We have some evidence that getting parents who are not up to date with the schedule, if you get them interested in the topic, if you get them to pay attention to the topic, there's some evidence that it can move attitudes, which is a good thing, and something that certainly the practitioners and people working in this space want to be able to do. They want to enhance confidence, they want to reduce concerns, but it didn't necessarily translate into positive future vaccination intentions, which is really the ultimate goal, right? It's nice to have people more confident, but we would trade it for the behaviors itself, to get them to actually say, yes, I intend on vaccinating in the future. Rather, what it seemed to do was make parents much more certain. Took the people that were kind of unsure at time 1 and kind of sent them into 2 different camps, and a lot of those people went into the no camp. So it may have driven information searches in other spaces. I think it's worth noting, I didn't really highlight this in those figures I showed you, but yes, while confidence went up at times, they started off at a much lower level than the fully vaccinated groups. So sometimes it went up, but it only went up to maybe a moderate level of confidence, maybe not enough to push them into the camp to vaccinate. Same thing with concerns. Yes, it pushed them down, but they were starting off with pretty high levels of concerns at time 1. So yes, it pushed it, but it didn't seem to be enough to kind of make it a tipping point where they would go into the yes, I need to vaccinate camp. And I guess the question moving forward is, how do you bridge this gap, right? How do you bridge the gap between people that are not choosing to vaccinate and the ones that are choosing to vaccinate? And so I have other stuff, but I cut it here thinking that would be probably a fair amount of time, and it seems to be somewhat on schedule here.
Awesome. Right on schedule. Thank you so much.